You've been doing it several times a day, every single day of your life, and you've never questioned whether you're doing it correctly. But the way most men urinate is slowly damaging their prostate, weakening their pelvic floor, and setting them up for serious problems as they age. I'm Dr. Susan Parker, wellness advocate and urological health specialist, and today I'm going to reveal the common urination mistakes that 90% of men make, and more importantly, the correct technique that protects your prostate and bladder for decades to come. Let me start with something that will probably surprise you. The standard way men urinate, standing at a toilet or urinal, rushing through the process, and walking away the moment the flow stops, violates nearly every principle of healthy bladder and prostate function. You're creating incomplete emptying, building residual urine that breeds bacteria, straining your pelvic floor unnecessarily, and training your bladder to develop problematic habits that worsen with age. The consequences don't show up immediately. That's why this issue flies under the radar for decades. But by your 50s and 60s, the accumulated damage manifests as frequent nighttime urination, weak stream, dribbling after you think you're finished, urgent sudden needs to go, and chronic prostate inflammation. Most men accept these symptoms as inevitable aging, never realizing they're largely self-inflicted through improper urination technique. Here's what actually happens inside your body during urination. Your bladder is a muscular bag that stores urine. When it's full, nerve signals tell your brain it's time to empty. Your brain then sends signals that relax the sphincter muscles holding urine in and contract the bladder muscle to push urine out. Simultaneously, your pelvic floor muscles must relax completely to allow unobstructed flow through the urethra, the tube running through your prostate and out through your penis. This is a coordinated neuromuscular event requiring relaxation as much as contraction. And here's the critical point most men miss. You cannot fully relax your pelvic floor while standing and rushing. The standing position keeps your pelvic muscles partially engaged for balance and posture. The rushing mindset keeps your nervous system in a slightly activated state that prevents complete muscular relaxation. The result is incomplete emptying every single time. Incomplete emptying means residual urine sits in your bladder after you think you've finished. This stagnant urine becomes a breeding ground for bacteria, increasing infection risk. It also stretches your bladder over time, weakening the muscle and making future emptying even less efficient. And that residual urine presses against your prostate, causing chronic low-grade inflammation that enlarges the gland and worsens urinary symptoms in a vicious downward spiral. Now let me explain the single biggest mistake men make while urinating. And this one is so common, it's practically universal. You push or strain to make the urine come out faster or to empty completely. This is absolutely devastating to your pelvic floor and prostate health. When you push or bear down during urination, you're activating your abdominal muscles and creating downward pressure. This pressure forces your pelvic floor muscles and your prostate to work against resistance, straining them unnecessarily with every single bathroom visit. Over years and decades, this repetitive strain weakens your pelvic floor, contributing to the very problems you're trying to avoid. Poor bladder control, weak urinary stream, and prostate issues. It's like doing a damaging exercise hundreds of times every month for your entire adult life. The cumulative effect is significant, but because it happens so gradually, you never connect the dots between your urination habits and your declining urological health. The correct technique is counterintuitive but remarkably effective. First, whenever possible, especially at home, sit down to urinate. Yes, I know this challenges conventional masculine habits, but the physiological benefits are undeniable. Sitting allows your pelvic floor to relax completely in a way standing never does. Studies using sophisticated bladder pressure monitoring show that men empty their bladders more completely and with less residual urine when sitting compared to standing. Sitting also eliminates the balance component that keeps muscles unnecessarily engaged when standing. Your entire pelvic region can fully relax, allowing urine to flow freely without obstruction. This means less strain, more complete emptying, and reduced pressure on your prostate with every bathroom visit. Over months and years, this difference is profound. When you sit down, lean slightly forward from your hips, about 20 to 30 degrees. This postural adjustment further opens your pelvic floor and creates a straighter path for urine flow through your urethra. It's the same principle behind the squatting position that's optimal for bowel movements. Gravity and anatomy work together rather than against each other. Now here's the second critical component. Never push, strain, or force urination. Let it flow naturally and passively. When you feel the urge to urinate, sit down, lean slightly forward, and simply relax everything. Breathe normally, let your shoulders drop, soften your belly, and allow the urine to flow on its own. It might take a few seconds longer than your usual rushed approach, but those few seconds protect your prostate and pelvic floor from unnecessary damage. If you're having trouble initiating flow, the solution isn't pushing harder. It's relaxing more deeply. Take a slow breath in through your nose, and as you exhale through your mouth, consciously release all tension from your pelvic floor. Imagine those muscles melting and opening. Often, this conscious relaxation is all you need to start the flow naturally. The third component addresses what happens after the mainstream stops, and this is where most men make another critical error. The moment the flow stops, they immediately stand up, zip up, and walk away. But your bladder isn't actually empty yet. There's almost always a small amount of residual urine that needs an extra few seconds to drain completely. Here's the correct finishing technique. After the mainstream stops, stay seated, remain relaxed, and wait 10 to 15 seconds. Don't push or strain, just wait patiently. Often, a second smaller stream will release, finishing the job your bladder started. If nothing comes after 15 seconds, gently rock your pelvis forward and back a few times, or perform 1 or 2 gentle pelvic floor contractions and releases. This mechanical movement helps dislodge any remaining urine without straining. Only after you've waited and ensured complete emptying should you stand up. Even then, don't rush. Stand slowly, wait another moment, and if you feel any residual urge, sit back down and release that last bit. This might sound excessive, but this simple practice prevents the chronic residual urine that causes so many problems later. Let me share the story of Richard, a 62-year-old man who came to me frustrated with his urological symptoms. He was waking up 3 to 4 times every night to urinate, his daytime stream was weak, and he frequently felt like he couldn't empty his bladder completely. He assumed it was just age-related prostate enlargement and was considering medication. I asked Richard to describe exactly how he urinated. He said he always stood. He often pushed to empty faster, especially when in a hurry, and he walked away immediately when the flow stopped. I explained that these habits were likely causing or significantly worsening his symptoms. I taught him the correct technique: sitting, leaning forward, relaxing completely without pushing, and waiting 15 seconds after flow stops before standing. Richard was skeptical, but willing to try. Within 2 weeks, he noticed his nighttime bathroom visits decreased to 2 per night. By 1 month, he was often sleeping through with just 1 wake-up. His daytime stream strengthened noticeably, and that incomplete emptying sensation disappeared. His prostate hadn't shrunk, but by changing how he urinated, he eliminated the chronic inflammation and incomplete emptying that were driving his symptoms. Now let's address the psychological and social barriers to this technique. Many men resist sitting to urinate because they associate it with weakness or femininity. This is cultural conditioning, not physiology. Your bladder and prostate don't care about social constructs. They care about mechanics, pressure, and relaxation. Protecting your long-term urological health is far more important than adhering to arbitrary masculine norms about bathroom habits. At home, in private, you have complete freedom to use the technique that best serves your health. In public restrooms where sitting might be impractical or undesirable, you can still apply the principles of relaxation and not pushing. Stand if you must, but take your time, breathe deeply, relax your pelvic floor consciously, and never bear down or strain to speed things up. Another crucial mistake is the timing of urination. Many men ignore early urge signals and wait until their bladder is desperately full before going to the bathroom. This chronic overfilling stretches your bladder muscle, weakening it over time and making complete emptying progressively more difficult. It also increases pressure on your prostate continuously. The healthy approach is responding to the first reasonable urge. You don't need to run to the bathroom the instant you feel anything, but don't routinely hold it for extended periods either. When your bladder signals it's moderately full, find a bathroom within the next 10 to 15 minutes. This prevents overstretching while avoiding the opposite extreme of going too frequently with minimal urine, which can create urgency problems. Let's also talk about the just-in-case urination habit. Many men empty their bladder before leaving home, before bed, or before any activity, regardless of whether they actually feel the urge. This trains your bladder to signal urgency at smaller volumes, creating the frequent urination pattern you're trying to avoid. Your bladder learns to perceive normal volumes as uncomfortably full. Instead, urinate based on genuine physical sensation of fullness, not on schedule or convenience alone. Your bladder has a healthy capacity of about 300 to 400 milliliters. Training it to operate at this full capacity by only emptying when genuinely full maintains its strength and efficiency. The exceptions are bedtime and before long trips, where bathroom access is limited. But even then, only go if you actually feel some urge. Hydration timing also affects urination patterns and prostate health. Many men drink fluids randomly throughout the day and evening, then wonder why they're up all night. The strategic approach is front-loading your hydration. Drink the majority of your daily water before late afternoon, giving your body time to process it before bedtime. After 6 p.m., minimize fluid intake, taking only small sips when thirsty. This doesn't mean dehydrating yourself. It means timing your hydration intelligently so your bladder isn't processing large volumes while you're trying to sleep. Adequate daytime hydration actually improves urinary health by preventing concentrated, irritating urine. But evening hydration disrupts sleep and contributes to nighttime frequency that exhausts you and worsens overall health. Temperature also plays an interesting role. Cold environments cause reflexive tightening of your pelvic floor muscles, making complete relaxation and emptying more difficult. If possible, ensure the bathroom is comfortably warm when urinating. This seems minor, but environmental temperature does affect muscle tension throughout your pelvic region. Now let me address what happens when you urgently need to urinate, but you're nowhere near a bathroom. The worst thing you can do is partially release a little urine to relieve pressure, then stop the stream and hold the rest. This stop-start pattern during holding confuses your bladder's signaling, strains your sphincter muscles, and can contribute to incomplete emptying later. If you must hold it, commit to holding completely until you can properly empty in a bathroom. Another damaging habit is the post-urination shake. Men often shake vigorously to dislodge the last drops instead of waiting for complete drainage. This mechanical shaking doesn't effectively empty the urethra and can irritate the delicate tissue. The better approach is gently milking the urethra from base to tip with your fingers, or simply waiting a moment for gravity to do its work. Let's discuss medications and substances that affect urination. Decongestants, antihistamines, certain antidepressants, and many other common medications can impair bladder contraction or increase urinary retention. If you're taking any medications and experiencing urination difficulties, discuss this with your doctor. Sometimes simple timing adjustments or medication changes can dramatically improve your symptoms. Alcohol and caffeine are bladder irritants that increase urgency and frequency. They also act as diuretics, increasing urine production. If you struggle with urinary symptoms, eliminating or drastically reducing these substances often produces rapid improvement. Many men find that cutting out afternoon and evening coffee alone reduces their nighttime bathroom visits significantly. Physical activity affects urination too, but in positive ways. Regular walking and movement promote healthy circulation throughout your pelvic region, supporting prostate health and efficient bladder function. Conversely, prolonged sitting creates pressure and reduced circulation, contributing to prostate inflammation and urinary problems. If your job involves extensive sitting, take regular breaks to stand, walk, and relieve pelvic pressure. Here's something most men never consider. The psychological stress and anxiety you carry affects your pelvic floor tension and urinary function. Chronic stress keeps your nervous system activated, which maintains muscle tension throughout your body, including your pelvic floor. This tension impairs relaxation during urination, contributing to incomplete emptying and strain. Stress management practices like deep breathing, meditation, or simple relaxation exercises support healthy urination by allowing your pelvic floor to release tension. Even taking 3 deep breaths before you urinate can shift your nervous system toward the relaxed state that permits complete, easy emptying. One more advanced technique for men struggling with weak stream or incomplete emptying is the double voiding method. After your initial urination and the 15-second wait, stand up, walk around for 30 seconds, then sit back down and try again. Often, the position change and movement allows your bladder to release additional urine that was trapped by position or incomplete initial emptying. This technique is especially helpful for men with enlarged prostates or weak bladder muscles. Now let's address infections and inflammation. Chronic incomplete emptying sets the stage for recurrent urinary tract infections, which are much more common in men than most realize. The symptoms might be subtle: slight burning, mild pelvic discomfort, cloudy or strong-smelling urine. If you experience any of these, see your doctor promptly. Untreated infections can ascend to your kidneys or spread to your prostate, causing serious complications. Prevention is far superior to treatment. Complete emptying with every urination, adequate hydration, and proper hygiene form your first line of defense against infections. After urination, proper cleaning matters too. A gentle wipe or dab is sufficient. Aggressive rubbing can cause irritation that increases infection risk. For men who've had prostate surgery or radiation treatment, these urination techniques become even more critical. Post-treatment, your urinary anatomy and function may be altered, making complete emptying and pelvic floor relaxation more challenging but also more important. Work closely with your urologist to adapt these techniques to your specific situation. Let me give you the complete healthy urination protocol in simple steps you can implement immediately. When you feel a genuine urge to urinate, find a bathroom within 15 minutes. At home, sit down on the toilet and lean slightly forward from your hips. Take a deep breath, exhale slowly, and consciously relax your entire pelvic floor. Allow urination to begin naturally without pushing or straining. Let the urine flow passively while you breathe normally and maintain relaxation. When the main stream stops, remain seated and wait 15 seconds without any effort. If a second small stream releases, let it finish naturally. After the wait, gently rock your pelvis or perform 1 mild pelvic floor contraction and release to ensure complete emptying. Only then should you slowly stand up. Do this consistently every single time you urinate at home for at least 2 weeks. You'll likely notice improved emptying, reduced dribbling, stronger stream, and fewer nighttime bathroom visits. These improvements motivate continued practice until the technique becomes automatic. Track your nighttime bathroom visits as an objective measure. Count how many times you wake to urinate each night for 1 week before changing your technique. Then implement the proper technique and count again after 2 weeks. Most men see measurable reduction in frequency, concrete evidence that the technique works. Remember, your urological health at 70 depends largely on your urination habits at 40, 50, and 60. The damage accumulates slowly and silently, but it's never too late to implement protective practices. Whether you're 30 and preventing future problems or 70 and managing existing symptoms, these techniques benefit you at any age. Your prostate, bladder, and pelvic floor will thank you with decades of better function, fewer symptoms, more restful sleep, and greater quality of life. This isn't complicated medical intervention requiring prescriptions or procedures. It's simply urinating the way your anatomy was designed to work, respecting the mechanical and neurological realities of your urological system. The choice is yours. Continue the rushed, strained, incomplete urination pattern that slowly damages your prostate and sets you up for problems, or invest an extra minute with each bathroom visit to protect your long-term health. That minute, multiplied across a lifetime, is one of the best health investments you can make. Share this information with other men who deserve to know that their urinary symptoms might not be inevitable aging, but rather correctable technique issues. So many men suffer unnecessarily, never realizing that simple changes to how they urinate could dramatically improve their quality of life. Your urological health is foundational to overall wellness, confidence, and longevity. Protect it with these simple, evidence-based practices and enjoy the benefits of a healthy prostate and bladder for decades to come. See you in the next video.